Good morning, everyone. Welcome to the May 25th, 2021 Board of Police Commissioners meeting. We acknowledge that we are on the traditional lands of the Treaty 4 territory, treaty signed with 35 First Nations across southern Saskatchewan, parts of Alberta and Manitoba, and the original lands of the Cree, Saulteaux, Dakota, Nakota, Lakota, and on the homeland of the Métis Nation. To ensure social distancing measures are being met during this time, members of the board are attending through video conferencing, as are additional members presenting. I would like to remind those members who are attending to just make sure your video camera and microphone are turned off. If a member of the commission wishes to speak, that you enter your name in the chat window in order to be placed in the speaking queue. And when speaking, remember to unmute your microphone and enable your video camera. Can I have someone make a motion to approve the public agenda?
Bresciani.
Thank you, Lori. Commissioner Bresciani, apologies. Call the question. Any opposed? Hearing none, carried. And can I have someone make a motion to approve the minutes from the meeting held on April 27th, 2021?
I'll make the motion.
Thank you. Any errors or omissions? I'll call the question. Anyone opposed? Hearing none, carried. Our first report is PO 21-17, the Police and Crisis Team Pact, a partnership between the Regina Police Service and the Saskatchewan Health Authority. Chief, could I ask that you please introduce the report? I'll turn your microphone on. There you go.
Great. Thank you very much, Mayor Masters, and good morning to all members of the board. We've got a big agenda this morning for both the public and the private agenda. And so, yeah, happy to start off with the first report, which is our Police and Crisis Team. This is a partnership between our police service and the Saskatchewan Health Authority, and really has been a very successful partnership, and I think yields incredible results. And the results somewhat speak for themselves, but no one can illustrate the successes that we've had better than Sergeant Sherry Wild, who is in charge of our PAC team. Sherry is joining us this morning virtually, and Sherry will be presenting this report.
Thank you, Mayor Masters, councillors, and members of the board. As the chief mentioned, I'm Sergeant Sherry Wild, and I'm the supervisor of the Police and Crisis Team, or as we call them, PACT for short. Just want to say thank you for inviting me to share some of the work that we do on a daily basis. I'm also going to touch on Regina Hub Team as well, as that's part of my role in the PACT section, and just discuss some of the trends that we're seeing in the community. So to start, the Police and Crisis Team is a partnership between Saskatchewan Health Authority and the Regina Police Service. The PAC team was launched in 2015 and doubled in size in 2017. We currently have 2 officers and 2 mental health social workers, along with myself in the section. And on any given day, PACT works with 1 officer and 1 social worker from 8 a.m. till 8 p.m. The PAC team jointly responds to individuals experiencing mental health related crisis, including persons in crisis, those living with mental health and addictions concerns, and homelessness. PACT will also assist in incidents where a person poses a risk to themselves or others. Some of the types of calls for service that we attend to include attempt suicides, welfare checks, mental health warrants, assist citizen, and breach of community treatment orders. The goal for PACT is to improve the alignment and treatment and supports for the client. PACT also works to reduce repeat calls for service for police as well as repeat emergency room visits.
This made me laugh. She's so dry.
In 2020, PAC was involved in 2,241 case files compared to 1,783 in 2019. We had direct contact with 978 individuals and reviewed an additional 1,263 files, which again is an increase from 2019. Of the people PAC directly had contact with in 2020, 60 were taken to hospital for psychiatric or other medical services. 374 individuals were referred to mental health services, and 383 individuals were referred to other community agencies. 98 individuals declined PAC services, and then 187 individuals were diverted from Emerge, meaning that other arrangements were made in the community, and 68 were diverted from arrest. 2020 brought some new trends to the PAC team due to the COVID-19 pandemic, and so I'm just going to highlight 3 of the trends that we noted. First, many of the clients who were well connected in the community lost those connections to services. We know that there were no face-to-face doctor's appointments or counseling appointments. Many of the services went virtual. However, a lot of the clients in the community don't have access to a telephone or the internet. Secondly, we saw a new wave of referrals. So these would be people we typically wouldn't have seen, but due to the pandemic, job loss, relationship breakdown, and lack of social supports, there was a cry for help for a lot of people who necessarily wouldn't have had PACT interaction pre-COVID. And then thirdly, there was an increased demand on PACT to fill the gaps for other service providers. So we assisted with an additional amount of welfare checks, liaised information between an agency and a client, and even let clients use their cell phone for contact with their psychiatrist so that they didn't lose contact and treatment plans. And although many of these services don't require police involvement, there are still COVID protocols going on right now that limit the interaction between an agency and a client. So PACT is continuing to assist with clients in scheduling and transporting people to service provider appointments and to continue to assist with these welfare checks on clients who are already well connected. We want to ensure that their connections are maintained because we know that there is a likelihood that they will come back through police contact and a call for service if some of those connections are lost. I'll quickly touch on Hub quick and then we can open it up for questions, I think. As part of my job in the Police and Crisis team, I also sit on the Regina Hub team. This is a team of designated staff from community agencies, police, and government ministries who meet weekly to address specific situations regarding individuals and/or families facing elevated levels of risk. In order for an agency to refer to Hub, they must first exhaust all efforts from their own agency. So referrals must need an integrated approach. The Regina Hub team was established in 2018 and has seen an increase in referrals year after year. In 2020, we had no meetings for a 6-month period due to COVID. The Hub team still discussed 49 referrals, 6 of which were stopped due to open MSS investigations. Regina Police Service brought forward 16 referrals and assisted with an additional 25. Some of the most common risk factors for the 2020 referrals were antisocial negative behavior, so this would be non-criminal behavior, mental health and cognitive functioning, and substance use. Of note, also chronic homelessness played a role as well. In 2021 so far, Hub has already seen 47 referrals in just a 5-month period. So I'd wager to say that we're already busier on par than we have been for previous years. And so those are just some quick highlights on PACT and Hub.
Thank you very much, Sergeant Wild. I think that's the conclusion of the report that supplements the written report that was provided in the agenda. And I think we'll happily take any questions.
Councillor Bresciani.
Thank you very much. I'll move the report as well if you need, Mayor Masters. So just in regards to the, is there a wait list for PACT or Hub currently through the chair?
There is not. No,
Okay.
we will, Hub has to offer service within 24 to 48 hours. That's part of the guidelines, and PACT functions the exact same way.
Okay, so I remember hearing a presentation a couple years back at the Mama Waston Center, and I thought I understood that there was quite a wait list for PACT, but you're saying that there is no wait list for PACT at this time.
Well, PACT is different in that it doesn't case manage. So we just connect people to services until they're deemed, somewhat stable. So they've got suitable housing, they're connected to their psychiatry. We get a lot of our regular PACT clients calling us back. And so in essence, we do case manage, but there's never a wait list. We will always try and get back to you within the day if possible.
Okay.
The wait list would be in regards to waiting for those psychiatry appointments, a bed at social detox. Like sometimes there is a bit of a delay, but that's in the not necessarily the first interaction with PAC, but some of the follow-up stuff will have a wait time to it.
Yeah, okay, great. You talked about some of the trends that you're seeing through COVID, the lost connection to services. So what has been, I guess, the impact on Regina Police Service in that? You can just elaborate.
Well, there's definitely, with some of the clients that we see with PACT, they've generated more calls for service. So there's been more police interaction because the way they were managing mental illness and addictions is no longer there. And so, even something as simple as going to an AA meeting has now gone virtual, and a lot of clients don't have access to that. So we've seen an increase in calls for service generated for some of those people who likely, had they stayed connected, likely wouldn't have come into contact with PACT.
Okay, yeah. So you indicated also welfare checks. Can you just elaborate on that too?
Yeah, so welfare check would be a service provider or a family member calling us saying, I'm concerned about John Smith. I haven't seen him. He made some statements. His Facebook posts seem not normal. Can you check on them? So police on a daily basis do welfare checks for situations like that. But we saw an increase in service providers asking us for welfare checks. So somebody from probations who's now working from home and can only contact their client via telephone, and their client doesn't have a telephone. They haven't heard from them for weeks and they're concerned for them. So they will contact PAC to assist with some of those welfare checks. Same goes for other service providers. I just gave probations as an example. So that's new. We normally didn't see that because those people would have been able to do those welfare checks on their own.
Yeah. Okay.
But yeah.
Through the chair. So how is that reported back to the government? Like, how does that reporting happen back so changes can be made of the impacts through the chair?
So I mean, we're documenting here on the PACT crisis reports, and those go back through the government. But I'm not sure necessarily when we document, we don't always document all the types of calls for service that we're assisting on. So I think our year-end PACT report for 2021 will show an increase, but it might not catch all of the calls for service because PACT really only touches the surface level of some of these things. Patrol is also getting excessive welfare checks from agencies that maybe don't come through PACT. So I think it would be we would have to do a totality of the PACT stats and the calls for service for General Patrol to see where those welfare checks are coming.
Okay. In regards to the PACT, you indicated 2 officers, 2 mental health, and the time is from 8 a.m. to 8 p.m.
Yes.
What about so nothing goes later into the night. So what happens with those calls? Then they just go to patrol or whoever's on? Is that how it works?
Yeah.
Sure.
Yes. So patrol will take those calls for service. Short of having a brief detox or hospital and cells, there really is nowhere to take somebody in the evening anyway. So they mitigate best they can and will refer to PACT in the morning. So that's where those follow-ups come up. We're constantly following up on anybody who's in detention who needs to see PACT, anybody who had contact with the police and maybe they safety plan, but we want to check on them the next day. So a bulk of our day is following up on the stuff from the evening before.
Yeah, okay. Just the last question I have in regards to on page 8 and 9, it was the risk category. When you're looking at the risk, basic needs was 17, poverty was 14. Can you just elaborate on the basic needs? Like, what does that mean compared to poverty, I guess?
Like basic needs means not being able to buy groceries, provide for yourself. It also includes hygiene as well. So some people don't live in poverty but still can't function to maintain their basic needs. So that's the difference between the two categories, but they often go hand in hand.
Yes. Yeah. Okay. Great. That's all I have for now. I'll let others ask. But thank you again for the work you do. This is very important.
Thank you.
Thank you, Councillor Bresciani. Commissioner Bushi.
Thank you, Mayor Masters. Actually, Commissioner Bresciani actually asked my questions, but I'm just going to follow up because I don't think it was answered. I guess my specific question. So my question in terms of scheduling, I think again, and I don't want to repeat things here, but my question is, when it's 9 to 6, and say there is a Rough Rider game that day, and 6 o'clock the PAC team is gone. I'm just curious, what happens then at 7:30 or at 7 o'clock? If there is any mental health, crisis or any, issue that needs a PAC team. I think you've sort of touched on it, but I wanted to know, do people just get referred to other services, or do you plan your schedule so that on a Rough Rider game day or a busy event, you're working 24/7 or something, or is this a standardized sort of schedule?
Yeah, it's very standardized in that we always work that 8 to 8. COAST, which is the Crisis Outreach and Support Team, functions exactly like PACT, but they don't have a police officer, and they work out of the mental health clinic. They work until 1 a.m. and so they often are who patrol is calling if they need access to health information or a patient needs to be assessed by a mental health clinician. They will call COAST, and COAST will attend out to a call for service. They will attend out to our detention facility. They, in essence, function very much like PACT, just as social workers. And then there are times where police will attend calls for service where the person's transported to hospital. So we know that they're going to be connected via hospital from their short time that they spend there. But PACT will also follow up with them post-admission or like if they're admitted or released on, a connection to counseling or services in the community. PACT will still follow up with these people to ensure that there's no gaps in any services that they didn't get.
Mayor Masters, can I jump in on that question for Commissioner Bushi as well? So similar to what Sergeant Wild had said earlier, part of the challenge that we have is the lack of services that are available after hours. So it's one thing to have the PAC team there or the COAST team there, but they are very, very limited where they can take individuals who need help. The hospital is really one of the only opportunities that we have to take someone. And so this is, when we talk about gaps in service delivery, this is one of the challenges that we have. So Sergeant Wild mentioned the COAST team, which does work a little bit later into the night. It is very, very common that our police service is called to assist the COAST team. So they are not comfortable going into the situation by themselves because often there's elevated risk or some danger that could be there. And so this really lines up with a lot of the training that we do for frontline officers in mental health. This is led by Sergeant Wild and our PAC team that do this training to our frontline, and all kinds of processes in place to try and really geared towards providing individuals with the maximum amount of help that we can, even with limited resources and places that we can take individuals who need help after hours.
Thank you, Chief. And I agree as well. I think I see this as a critical, care service. I also see this, especially when you're dealing with mental health as well, right? People don't, mental health, crisis cannot wait, until 9 a.m. before it happens. So I'm wondering why we're not maybe looking at, say, the schedule as in a hospital, for example, where it's 24/7, a rotation 11 to 3, and then 3 to 11, and then the next person comes, so that it's a 24-hour schedule. Again, given that, when we look at those risk categories, there's 23 numbers of when we look at mental health. And is there an appetite to increase the mental health workers? Because again, we have heard, recently where police officers go and do mental welfare checks and it didn't go too well. And so I'm wondering, is there any appetite really to increase the number of health care service providers, so social workers, even nurses, mental health specialists, something to add to the PAC team?
So I'll jump in on that question, Commissioner Bushey. Thanks for the question. I think it's safe to say absolutely there is an appetite for it from a policing perspective, but we need an appetite from health, from mental health, and addiction services, you name it, to provide extra resources. I've been asked before if we would like to expand our PAC team. We would, but adding more police officers isn't what we need to our PAC team. We need a commitment of healthcare workers. Those are the ones who are able to really help understand and triage these situations as they come in. And so the capacity levels that we have really are not about extra police. We have provisions built into our growth plan that we can add extra police if we can get adequate amount of extra health professionals, but it can't just be more police, because then it would be no different than what we offer from a frontline patrol perspective. So increasing the hours with more resources in that section is a possibility, but again, in the middle of the night, there's very limited places other than the hospital to take someone, and putting, I think we would all agree that just adding more police officers to the hospital or to this team is not the solution. We need more from our health partners, and that's something that we continue to work toward. We're in conversations with them as we speak to try and increase our PAC team, which would allow us to provide better coverage, 24-hour coverage, but it only really is effective if we can get commitment from health as well.
Okay. So Chief, if I may come in again, so I think what you're saying is not just an increase in social workers, but also increase in services. So in the middle of the night, right? Other than the hospital, you want other health organizations open where people can be referred to there, because the hospital is only the only place really that people can go to really in the middle of the night. Is that correct?
Yeah, you're bang on, and Sergeant Wild would be able to speak to that, in more detail. But at the end of the day, in the middle of the night, the options are police and hospital. And
Right.
Many times those are not what is needed. Many times that's not what is needed. And so we need to have more options out there, not just to respond to calls, but individuals that are in place that can provide meaningful help at that moment, not refer them for 2 weeks down the road, not set an appointment in June, but help them at that moment. And right now, police and hospital are the two choices that we have.
So Chief, how can the city help with this issue? And that's my last question. Thank you.
Yeah, thanks for that question. I think that, when it comes to this issue, there is things that can be done in terms of providing, for example, the warming place was a safe environment for someone who could go, who maybe was looking for food, was needing something that they couldn't get on their own, or they weren't able to provide themselves. And so we were able to work collaboratively with that community-based organization to provide that. There are a few community organizations, but again, it comes down to what services they can provide, and oftentimes the service they can provide needs to be provided in a safe environment. So having a location where people can be taken to have their needs met, they need to be taken there in a way that it's safe for the individuals that work there. So for example, the warming place, who we worked very collaboratively with this year, they were a new facility this year, we responded many times there for challenges that they had when individuals either showed up on their own or were transported there from various different agencies, sometimes taking a cab, whatever, and then there were issues that arose. So these are complex situations and the need for trained professionals with mental health background, social work background is something that would be very beneficial and really something that's going to come in collaborative partnership with the province.
Thank you, Commissioner Bushi. Councillor Stevens.
Thank you. Sherry, thank you very much for the presentation. It was very helpful. I have a question about a section of the report that comments on appeals by some segments of the public to develop non-police responses to the issues that are identified in the report and that you and the chief have outlined. So I have a question about the operations of some of these responses. So for instance, if we're talking about a non-criminal, antisocial, or problematic behavior response, mental health and cognitive functioning by example here in the report, who takes the lead on this? If you have 2 officers, 2 mental health support workers, and you get a call that there's a mental health or antisocial behavior issue, does the RPS officer take the lead when that call is dispatched, or it would be the support workers?
Okay, so when we're looking at that antisocial stuff, that's associated to Hub, and those are not things that are dispatched. Those could have come from a previous call where these risk factors were identified and then it was sent forward to Hub. So it's kind of tricky in that sense, but when officers are attending to those types of calls for service, it is still the police who are taking the lead. So it's a matter of them trying to connect the person to service. So that involves the police driving the person to income assistance to try and get them an emergency work appointment for shelter. It's the police taking the individual to mobile services. Most of those service providers do not come to the client, especially right now during COVID protocol. So it is still police driven. A lot of those Hub referrals, you'll see police were part of 41 of the 43 Hub referrals. It's the nature of how things are right now. There's some hesitancy depending on the day and the client and how they're presenting. And so the police are there, but when we're going out in that Hub capacity, I often step back and I'm leaving it to the mental health clinicians, social workers and staff to do the connection to services. I'm just kind of there in the background.
That's helpful. Perhaps you could comment then on how this changes the relationship with the call for service. So an RPS officer versus someone who might be in a support role. Do you find that there is an escalation with the officer versus someone that's non-uniformed and there to support in another capacity?
I don't, but I mean that we don't always get the true expression of what the client is most comfortable with. I know in the times, like especially in those Hub situations where police attend, people are more than welcome to let the police in. It gives the client a different perspective because in essence, I might be the person driving them to their appointments. I might be connecting them to housing, and that's not a side of policing that they typically would see. So I don't see a lot of hesitancy out there. Do people want police coming to their door to offer those services? Maybe not necessarily. However, that's sometimes how those connections are made. And we do some follow-up, and people are thankful in general, but we use it as a multi-agency approach. So I don't know. I can't say for sure, but if you're asking what my opinion is, I would love to see a street-style team of psych nurses, mental health resources that can attend to a lot of the stuff that are not police related or in conjunction with police, but they are the lead. And so that's where some of that gap is. Coast does do that, but again, Coast only is touching the surface just like we are. There's a lot of demand out there and we can only, you're in essence, you're plugging holes to some of the escalation in behavior.
Thank you. So my final question is something that you had pointed out there. What do you think the optimal staffing level would be for the team that you've just identified? So clearly you and the RPS know what needs to happen. What is the staffing level for that special team you just identified?
I think we could double the PAC team that we have again, but like Chief Bray said, there still has to be some options to take people too. And so a lot of our service providers are a Monday to Friday 8 to 5, and short of Coast and Mobile or hospital, it's really hard to connect the dots. Brief detox is used quite often, but it's not a secure detox. And so when people are extremely high on certain drugs, brief detox isn't the best option for them because they can leave and still be a risk of safety to themselves. So if we had places with secure detox, more treatment options for long-term detox, I think expanding to a 24-hour team would work. But right now, I still think we could probably double and have like a day shift team and then maybe a one-to-one or something to cover off some of those peak times for calls for service to do a lot of it, where we can maybe mitigate and divert arrest just by our presence and showing up.
Perfect. Thank you so much.
You're welcome.
Thank you, Councillor Stevens. Commissioner Bither.
Good morning. Thanks for all the information that you've shared with the board. Just wondering, how many officers are assigned to this group?
To our PAC team?
That's right.
Yeah, we have just the 2 officers. So we have, on any given day, 1 officer and 1 social worker working. So we're just a team of 2 people that are together in 1 car every day. So my officers rotate through a shift pattern and the social workers rotate through a shift pattern, and they each work with each other, but my team never all works together. So someone's on for 5 days and then the next person's on for 5 days.
So is there any special training given to these officers, how to deal with these situations, or how does that work?
Yeah, so our PACT officers have mental health first aid along with the assist training. Some of my officers also are trained in Road to Mental Readiness, which is another version of mental health training. And then we rely on our social workers to use their skills, because they're the ones that are assessing, in a sense, because they're the ones that are qualified to make decisions and assess, and they're consulting with psychiatrists. So we're relying on them as well.
Okay. And how many, like, if you look at the bigger picture, like for RPS, have you done any sort of like a data analysis? What is the percentage of PACT calls or relating to this unit versus the overall RPS calls?
I'm just in the middle of looking at that, because I know that I can tell you our PAC team is really only touching the surface on mental health calls for service, because again, we're one team. So if we're out assessing with 1 call for service, we can't attend any other calls for service. And by nature of PACT, we can spend longer amounts of time with clients trying to safety plan, get connections to family or other supports. So sometimes we're with a client for 4 to 5 hours a day, and we only work a 12-hour day shift. So if we're helping 3 or 4 people like that in a day, that's really all that we can do, short of some calls from patrol for some general information or guidance on what to do for a call. But we just can't be everywhere at once. We're just spread so thin.
My last question is, how does RPS knows that this is the time to engage PACT? I'm trying to figure out when a call is received. There's sort of some assessment being done, hopefully, that will figure out, okay, this is probably needs to be engaging the PAC team.
Yeah, our officers are trained on how our PAC team works and what our mandate is. There are times where frontline officers will assess a person on their own. They're trained in mental health training as well, and they make a decision to transport the person to hospital. So the PAC team would not become involved, because that goal is to take the person to see psychiatry. So there's nothing that we're going to offer them that's going to be any better than them seeing psychiatrists. So patrol doesn't always consult us, or they'll call us and say, hey, I have John Smith with me and I'm taking them to the hospital. Is there anything else I need to know? So we're getting context like that, but our dispatchers and frontline officers are trained to call us. So if there's a mental health component, they're looking for information on, does this person have a worker? Are they connected to psychiatry? They know to call us, and we're also listening as well and watching the calls for service. So we often will share information while the officer's en route to a call about the fact that, say, the person just saw their psychiatrist yesterday, so taking them to hospital is likely not going to be the right option, and that's where that divert emergency room stat comes from.
All right. Okay. Thanks, Sherry.
You're welcome.
Good work.
Thanks, Commissioner Bither. Councilor Bresciani, you had follow-up questions?
Thank you. So I just, in regards to the coordinated efforts, so we've got COAST, we've got Mobile Crisis, and then we've got PACT. So those are the three main. There's no other ones that are working to assist. Would those be the three main, through the chair?
Like under the COAST umbrella, they also have CRT, which is the Community Recovery Team, and CRS, which is the Community Recovery Services. They're more the dealing with the more difficult cases. So ones where clients need maybe day-to-day interaction, they need rides to appointments. So they're kind of follow some of they would case manage in essence is what I'm trying to say. But we can refer to them and we work with them. If it's a client of theirs, we will call them and notify them of some new information and make a plan together. But when you're talking about people who are going to be attending out, it's usually police and COAST, and then mobile after hours.
Okay. In regards to suicide, we've seen an increase in suicide, and I want to ask if there's a call and someone has taken their life, what is the standard for PACT, or does it go then directly to COAST, or how does it work for that?
Yeah, so if there's a suicide, PACT is not involved. It goes to Frontline, and then Victim Services becomes involved. Our goal in PACT is to connect people to services. So if there has been a suicide, then there's that kind of work. Our mandate work does not fit into that. That doesn't mean that we don't follow up with people later, especially if it's a previous PACT client or somebody who's had PACT involvement. We'll reach out in time, but if there's a completed suicide, we're not attending that call for service and we're not offering. That being said, we've been asked a few times for family who then are presenting in distress due to the information that they heard. We will attend out. So we've done that for a few suicides and homicides as well, where the family member now is at risk possibly for suicide based on the notification of the death of their loved one. We will assist in that sense, but we won't assist. We can't do anything for the client who has completed suicide. Yeah.
Okay, but the family that's in distress would be also impacted, as you indicated. Yeah.
Yeah,
okay.
absolutely.
Yeah. Okay. So I guess I'm just trying to figure out the coordinated effort. So we've got the PACT that's from 8 to 8. We see a demand that probably needs to work into the later hours because we've got excessive work when the next day comes. What about coordination between COAST and between Mobile Crisis? Like between the three, has there been a coordinated effort to meet some of these other times so it's not all during the day, or for a call for service, but also for coordinated times to work together to fit different time frames? Has that been discussed at all through the chair?
Not that I'm aware of. Like we have our hours, and then we know that, like I think we just know that's where the providers are during certain times. I don't know if there's been any discussions on how to collaborate during some of those times, because mobile will only see people after 5 p.m. If it's before 5 p.m., they have to go to social services. So most service providers and even clients in the community know where to get the services during certain times. But if I could wave a magic wand, I would love to have a bunch of service providers at one location that's like a one-stop shopping for people to come at all times, right? If they need connection to shelter, if they need connection to income assistance the next day, if they need mental health addiction support, if they have a police question, any of those kinds of things.
Okay. So just to be clear then, Mobile Crisis is 5 p.m. till what time?
They would work till 8 a.m. and then anything after 8 a.m. goes back to social services.
Okay. And what about COAST?
COAST, they work 8 a.m. till the 1 a.m. So they have two teams. So they have a day shift team and then a afternoon evenings team.
Okay.
That works.
Yeah. Okay. So Mobile Crisis is the only one that would take on the night. The you said after 5 p.m.
Yeah, and they're not. There's no connections made to services at that time. It's shelter. It's strictly shelter. So it's them putting somebody up at one of the shelters or hotel for the night until they can reconnect with services during daytime hours. So there isn't a lot. Like mobile will come out for certain investigations involving children, or if there's a death and they need some supports, they'll come out for that. But somebody who's in crisis will not get any supports other than shelter from mobile after 5 p.m. or if Coast comes out to assist.
Okay. Yeah. Okay. Okay. And just the last question: Has PACT, your team, requested any additional resources or dollars to increase for the later times?
Yes, we've been working on that in conjunction with health. It's just health is so inundated with COVID stuff that it's on their plate, but we haven't put a formal request in just yet. We're just working with managers to see and assessing what other PAC teams across Canada are doing as well.
I did notice in the report it says across Canada there's been a suggestion that the crisis team such as PACT should not be police-led, and the paradigm shift. But it seems that it's well needed here.
It is to a point to get, unless there's other providers that are going to get up and running, but it still would be a partnership with police as well. That's the only way I think it would work together. But there are a lot of calls that we don't necessarily need to go to, but there is no provider willing to go at this time. So I think if we can see more social work type street teams that are out and able to connect people to services, that would be helpful.
Okay, and do we know what the cost would be from the police end through the chair?
That I can't speak to. I'm not sure.
Are you, Councillor, are you talking about the cost for additional police resources, or what was the question with regard to?
Well, that's right. It would be the extra resources that we've heard from Sherry today that would be needed into the hours, the later hours. From a police perspective, but then also, again, that would give us the information to go to health with.
Yeah, I think, this is something that we are constantly working with health. I mean, if we were to add 2 more police officers, it would literally just be the cost of those officers. But we would need that supported, meet us in the middle from the health region or social workers. But, again, part of the challenge, and I know we've probably addressed this 2 or 3 times now, but part of the challenge with not just us, our PAC team, but Coast and Mobile is after a certain time at night, it's not about connecting them to service. It's about giving them a place to sleep is about the only options we have, or taking them to the hospital. So, we could put 20 more police officers out there working with social workers to try and address these issues after hours, but unless they've got somewhere to connect them, it's really no different than what we're doing right now with patrol officers, and likely not where the energy and focus should be.
Okay. Can I just ask the chief, in regards to, I know Saskatoon, I remember asking this question at budget, they did increase, did they not increase their funding to PACT as well?
They put 2 new police officers in PACT using a build it and they will come mentality, and they haven't come yet. So they're waiting for connection from health to meet that. So again, it doesn't make sense for us just to add police officers to this section, although we know we could double the section tomorrow, but it's got to be a combined effort, and that's what our focus is.
Okay, great. That's all I have. Thank you.
Thank you, Councillor Bresciani. One last call for questions from the commission. Hearing none, I'll thank you very much for the presentation this morning. Wonderful work and wonderful presentation. Thank you.
Thank you.
The report is to receive and file. It's been moved by Councillor Bresciani. I'll call the question. Anyone opposed? Carried. We'll now consider PO 21-18, the Violence Against Women Advocate Case Review. Chief, could I ask that you please introduce the report?
Sure. Thank you very much, Mayor Masters. We're very proud of this work. This is very unique work in Saskatchewan to the Regina Police Service and to our city. The Regina Police Service is very committed to improving police response for survivors of sexual assault, and really what this is about, it's about bringing in experts in our community to help improve that response and really help improve the way in which people who are survivors of sexual assaults and sexual violence are handled, not just in the policing part of their interactions, but really through the entire justice system. And so this has been a pilot project that we put our hands up in Regina and said we would be proud to be part of this, and it has been a very positive experience. And the two that are going to talk us through this report and give us some deeper understanding are Miss Lisa Miller from the Regina Sexual Assault Center and Staff Sergeant Chris Jacku, who's been the Regina Police Service lead on this project, and they're both joining us virtually this morning.
Good morning, Mayor Masters, councillors, members of the board, and Chief Bray. Thanks so much for the opportunity to talk about this project with you. You've received a very thorough board report, and so I'm just going to go over, I guess, a couple of the highlights of that report from the community organization perspective on this. So VACR has been in Regina now. It's been an active project for about 18 months in Regina. Sort of the core reason why VACR exists is because we know that gender-based violence, has very low reporting rates. It's got high attrition, so individuals that do come forward often don't stay with the criminal justice process for various reasons. And then we also have very low charge and conviction rates. And again, there are a variety of reasons for why that is. VACR came from what was the Philadelphia model. So in the city of Philadelphia, they had some issues with their sexual assault files. And it led to the commissioner at the time doing a thorough review of all their sexual assault files and found that there was some mishandling of the files. So they brought in sexual assault agencies to review files and provide the police service with feedback on what could be done to enhance the reporting process, as well as what could be done to encourage people to stay with the criminal justice process. So in Canada, we had a similar movement happen where there was some awareness raised about how sexual assault files were being handled by police, and it led to Sunny Mariner, who was with the Ottawa Rape Crisis Center. It led her to learn about the Philadelphia model and decide that she was going to bring it to Canada. Did a lot of work on her end to make it fit to the Canadian context, and then she went and started selling it to police services. There's about 20 police services in Canada that have adopted this model. There are some slight differences between the Philadelphia model and VACR. The key one being that the reviews occur quarterly. The reason for this is that the feedback that the review team provides, the files are not so dated that if there was some additional investigative potential there, that the files could be reopened, based on that feedback. So with Philly, it's every year. With VACR, it is quarterly. The similarity between the two models is that both of them provide a mechanism for evaluating the investigations, providing feedback to address what we know are some barriers and inequities around, response to individuals that report sexual violence. And it's I think, an amazing project because it allows for some enhancement of that response at the entry point of the criminal justice system. So the pilot in Regina started about 18 months ago. The project partners were Sexual Assault Services of Saskatchewan. We had some support from the Ministry of Justice, Corrections and Policing, Status of Women Office, and then our organization, which is the Regina Sexual Assault Center. There was some work done to bring it in line with Saskatchewan privacy legislations, and additionally, the files that we review, victims have to be 16 years of age or older, and the suspects have to be 18 years of age or older. So those are just a couple of sort of local context pieces. The review team composition. So currently, most of the individuals are employees or staff of the Regina Sexual Assault Center. The reason for this is one of the criteria for the review team composition is that they're individuals that are doing core sexual assault work. So they are doing this work day in and day out and have a really thorough understanding of why people don't report, what some of the barriers are to reporting, and why sometimes people fall out of that criminal justice process after reporting. The other piece is that individuals working with sexual assault centers are bound by privacy and confidentiality, and we take that very seriously. And so we bring that to the table as well, because obviously this type of work, reviewing police files, we want to ensure that privacy and confidentiality are, first and foremost in the work that we're doing. The last reason why it's a sexual assault organization is it is arm's length from the criminal justice process. So we have a lot of amazing agencies that do work with individuals, victim services being a great example. But because of their close connection with the criminal justice process, they're looking at it through that lens. And it is sometimes more challenging for individuals to provide critique of work when these are individuals that they, the officers, they're people that they work with day in and day out. We have completed the pilot project. We have a final report that I believe is going to be available at some point. We're just working through the details with our partner in the project. And I just want to say we've got commitment from Regina Police Service to continue with this project and continue with the review. And we've just been thrilled with the outcomes from the pilot project, and we look forward to continuing.
Thanks. Good morning. Staff Sergeant Chris Jackie with Regina Police Service. I'll just sort of introduce a little bit about the police role in this. My role specifically was as a liaison officer between the reviewers and the Regina Police Service. So my job was to establish the appropriate workspace for them, ensure that all files were obtained and downloaded, and that they had everything that they needed to conduct the reviews, as well as provide with them with a little bit of information about the investigative process, about police protocols, that type of thing, policies and procedures. As well, part of the review process was, again, reviewing files of concerns and taking feedback from the reviewers at the end of each review. Some of the key findings from the review that they determined in the review process: a number of incomplete files, such as lack of suspect interviews, evidence collection, victim communication and support, a number of over-requesting of Crown opinions on the files. Our officers were hesitant to make decisions on the files initially, and I think a lot of that was due to lack of knowledge and skills by the officers to deal with the specific types of investigations, that being sexual assault files. Very sensitive, and did not want to take a position of making a wrong decision, because it's very impactful for both everyone involved. I think the most important role that I got to take on was how we responded to the findings, and I think this was the most important piece, and that was taking the feedback from the sexual assault review process and presenting it, sharing it with the managers as well as the frontline supervisors, and figuring out how we can improve ourselves as a service, how we can provide better service to victims overall as a police service. So as a result, we were able to develop a very in-depth sexual assault investigation policy and process. We did this as a shared collaborative approach with the sexual assault nurses, the Crown prosecutors, the Sexual Assault Center, as well following the national policy guidelines and police guidelines that were set out in the Canadian framework. I think as a result of this, we're able to provide our officers with more informed guidelines, more specific policies for understanding trauma-informed approaches to investigations, sexual assault investigations, understanding victim concerns, and how to move forward appropriately as investigators while taking into consideration our investigative requirements and needs. This is in turn turned into a half-day training for all officers on sexual assault investigations, leveraging all of our partners that we've established throughout this process, including the Sexual Assault Center, Lisa specifically, myself. We use some of our in-house experts, being our vice unit, and partnering with the Crown prosecutors. Ultimately, when these files do go to court, there's certain requirements that they require. So there's importance at every level of these investigations. We have enhanced training for select officers that have an interest in this area that are looking to develop some expertise. We've also aligned and adopted the Canadian framework to ensure that we're consistent across the country with these types of investigations and meeting the high standards that are required. Like Lisa mentioned, we're committed to continuing the review process. Even though the pilot project is over, the partnership is going to continue to ensure that we are improving in our investigations and the quality of them to show the impact that this 2-year pilot project has had, as well as information sharing with other agencies that are interested in doing the VACR within their own services, other police agencies within the province that have reached out to us specifically to get an understanding of the process and the intricacies of it. So definitely some mutual benefits for both agencies and as well as victims overall. Those are the ones that we undertook this project for, was to ensure that best process for them. So definitely more enhanced, consistent experience and support for those who choose to report sexual violence. Increased trust, collaboration, and communication between the agencies involved in the review process moving forward. Increased awareness of the Sexual Assault Center and access to staff to support victims. Even if they do report to police, we recommend the Sexual Assault Center for consultation and counseling. Mutual knowledge sharing and increased understanding of our roles, some of the constraints that we face, some of the obligations that we as a police service need to meet in the investigative process, as well as understanding of the laws and what we're able to do. And then continued communication about future ways to support victims. There's been some discussions about including an off-site interview room, a neutral site, and some other options. So we're going to continue to try to improve upon the process, develop what we've established, continue to build upon it, and try to provide the best possible results for victims. Thank you.
Thanks.
Thank you. Chief, do you have any comment?
No, I think that's a great summary. I started off saying it and I'll end saying it. We're very proud of this partnership. We're proud of this this process and this pilot that we took on, and we're committed to doing this going forward. We've had great collaboration from the province, who have taken on the financial responsibility for this and really allowed us to focus on improving our investigations and ultimately outcomes for survivors of sexual assault. So that's the positive from this, and yeah, we're happy to take any questions.
Thank you. Commission, do you have any questions? Commissioner Bushi? Commissioner Bushi, you're on mute if you're talking.
Oh, I'm sorry. I apologize here. Thank you, Ms. Miller and Staff Sergeant Jackie, right? Did I pronounce your name correctly, Jackie?
Yes, that's correct.
Perfect. Thank you. Thank you so much. I'm actually quite excited actually about this program. I've heard a little bit about the Philadelphia model, and I'm very happy to see it here in Regina. I just have a couple of questions. In terms of violence against women, or especially, and I know it's just 18 months, it's fairly new, it's still a baby and it's still being nurtured. What are some of the reports or information you've heard about or you've seen about how violence against women in the LGBTQ 2+S community, how has it been handled? Are you seeing any cases that have been mishandled as well in that community, or what's the demographic like in terms of the information that you're seeing?
Mm-hmm. Do you want me to
Yeah,
handle
that's
this?
more your-
Okay, for sure. Thank you so much for that question. It's an excellent one. So through the review process, we use I'll give you just a little bit of a background, I guess. We use a checklist to, as we go through information on these files. And one of the areas that we are looking very closely at is what is the response to individuals that identify as being part of certain populations, that we know are at increased risk of sexual violence, and that we know also are less likely to report, right, and also less likely to follow through in the criminal justice process for, again, a lot of reasons that are related to social attitudes, that sort of thing. The challenge with the gathering that information is that it's not always available or sort of evident in those files, right? So somebody may identify as LGBTQ2S as they're talking to the officer, but often they don't. And some of those demographics are just not collected, through the investigation process. And so when we can see it, we note it, and we are paying particular attention to those populations because of the low reporting and the high prevalence. But that's kind of where we're at with that. Does that answer the question for you?
Not quite, but I think maybe in the next time it will, because again, like I said, it's 18 months. There needs to be lots of data generated for a more robust response. But you've done well, so thank you in responding. I just have again maybe two other questions. I was reading here, I didn't see it. Maybe it's here and I missed it, so I want to apologize in advance. But what actually who makes up the VACR team? How many people are working in that unit?
Right. So we have currently 6 individuals who are trained, and the majority of them are individuals that are work at the Regina Sexual Assault Center.
Okay.
We have one individual who is the Sexual Violence Response Coordinator with the University of Regina, Lynn Thera. And again, when you look at the criteria for the review team composition, which was set out by Sunny Mariner, who developed the model, there's some certain criteria around who's ideally participating, right? But it's important too that we have diverse lenses participating in the review process, and we will be looking now that the pilot is over at sort of who else in our community may be a good fit for doing these reviews to ensure that we have inclusive lenses.
Thank you. And I think you also touched on my next question here, being that, in fact, a lot of your findings are not new to me. A lot of victims, especially in the BIPOC population, have been crying out because of these issues. And I mean, when I read lack of suspect interviews, it freaks me out, because really, who are you interviewing then? If you're not interviewing the suspect? But these are some of the things that, again, people have been complaining about, and I'm happy to see, what's sad as well, to see that, these things are coming to light. I just wanted to ask again, just to follow up 2 questions. Do you have any, in terms of diversity on your team? Because I think this will be very helpful if we have, people of color on that team, and because really they bear the bulk of social injustice in society. And I think that especially when they see somebody maybe that looks like them, or even have gone through similar issues as well, it might be able to or they might be able to build that relationship or feel comfortable or feel safe as well. And so I was wondering, and then in terms of follow-up, right? So you found that, say, this case A, there was lack of suspect interviews, and so the case wasn't handled correctly. What happens? Do you call that person, the victim, back and say, sorry, your case was not handled? Like, what happens? And what happens to the police officer as well who handled that case?
Right. I think. Sorry, Chris. Can I?
Please, you start off and I'll finish.
Okay. Yeah. So those are also really excellent questions. So the team at the Sexual Assault Center we have 2 individuals on our counseling staff that are have been newcomers themselves. One individual is Latina. The other individual has been in Canada for a few years, but is from the continent of Africa. So that they certainly bring that very important perspective to the review, and so that was the one sort of, I guess, question or thought that you had. So just to assure you that yes, we certainly do try and bring in that perspective. In terms of what happens with those files after, it is not for the review team to decide what happens with those files. We provide that feedback to the police. We say, here are some of the findings, here are some of the trends that we're seeing. And I want to assure to the board that these findings are not specific to police. I mean, police have an exceptional position of power in the community, but some of the challenges that we see, this is related to social attitudes about sexual violence, which is we all have internalized, right? And so it's, we see that those social attitudes raising their head in investigations. And so there's a lot of different pieces that have to be sort of talked about, and some education, some training around that again is a social issue. It can be re-traumatizing, re-triggering for victims to be called up out of the blue and be told, do you want to do more with this? So I, like, as an individual working at a center like this, probably would not advise that happened too often, unless it was something that the police felt they could reopen and reinvestigate. We're looking at what are the findings and how can we go forward to improve.
So, Councillor Boucher, I'll take over from there. It was my role to, as specific files were brought to our attention through the review process by the reviewers. Sometimes there are questions on the file, sometimes there are issues, sometimes there are just blatant concerns. On others, they were actual identification of exceptional work done by certain officers as well. So we would point out to them the great work that they did and the understanding and the interview process. So what happens is, if they're pointed out, I go through each file as well, any files of concern, and I will follow up with investigators on it. I've also looked at the file from an investigative lens, so a little bit different than the lens that Lisa and their team look at the file from, the investigative necessity. And I brought up the Crown opinions, if they've gone to Crown opinion, how the file was concluded as a whole. And I can assure you that a number of files in general were being concluded incorrectly with the wrong concluding status, which is what brought them to our attention in the first place and caused them to be reviewed, and probably should not have been concluded that we were concluded, and therefore probably wouldn't have been brought to our attention, but they were. So we were able to identify that our concluding statuses were not necessarily up to par, up to the national standards. So we've included in our new policy more informed guideline on how to conclude these files. We've also, through our training, educating our members on their own biases, on their own cultures, and their own social understanding of trauma-informed, victim-centered investigations. So we're really trying to find a balance between getting the best information we have to move forward with an investigation, while taking into consideration the trauma on these survivors and how to move them through the system. And we found that communication is probably the most important factor, is to have ongoing communication with people who report, with victims who report. Sometimes they don't want us to proceed because of the impact it has on their own status, on their family, on their friends, on their how they see themselves, but how others see them as well. So communication was a key factor. Plugging in our victim services into this process to make sure that they were informed of these files and make sure that the Sexual Assault Center as well. So we're working very strongly on the front end to support the victims, to try to encourage reporting to the police service so that we can do a more thorough job of our investigation and move it through the justice process to the potential for charges to be laid and it's going to court, which is why we included the Crown prosecutors in our policy development, as well as the training for all of our officers. We got an understanding of what it takes for the prosecutors to proceed in court with a file. And Zoe Ziegler was excellent in helping us out as a Crown prosecutor. She was outstanding. She brought a lot of perspective and knowledge to the table and expertise. And with our investigations, like the checklist that they use to review the files, we actually stole a little bit of that and incorporated that into our policy now to ensure that things don't get missed moving forward. These are supervisor reviewed process checklists to ensure that suspect interviews, evidence collection, victim communication and support, micro corroborations, video, witness statements, witness video, anything that we can find now to both corroborate, support the initial report is what we're intending to do.
Thank you.
Well, thank you. Thank you so much.
Commissioner Boucher, I'll just hold up, as the question was operational. Chief, could you comment, please?
Yeah, I just wanted to touch on something, and I might have misinterpreted Commissioner Boucher, but I want to make sure I clarify. I felt like you were asking as if potentially there was some, with regard to lack of suspect interviews, it's not being a derelict in their duties. It's not negligence necessarily on the part of police officers. And that's not my words. Those aren't my words. Those Lisa Miller used, and perhaps I can get her to speak to this. When we had our meeting with the province going over the final report, a lot of times lack of suspect interviews happens because, number one, the suspects refuse to come in and speak to us. And so if we're wanting to conduct an interview of someone, and it's a warned interview, they have to be willing to speak to us. And if they, after being given rights and warnings, are refusing to speak to us, you know, that's a case, that's a factor in the entire case, but it's not because the police didn't do their job and didn't try. In other cases, it comes down to this requesting Crown opinions where you're looking at it through a different threshold when it's the Crown prosecutors as opposed to police. So building that knowledge, those skills and abilities with regard to trauma-informed investigations has been an essential part of what we've done. So I just caught an element of your question where you said, what is happening to those officers? It's not that the officers are doing necessarily something wrong. It's the circumstances of the investigation and how that kind of paints the entire picture. So Lisa, I'm not sure if you can chime in there with anything you wanted to add.
Yeah, I think you covered that well enough. Just for clarification, so the checklist that we were using was the original one from the model, and oftentimes it was a simple yes or no question. So, for instance, you know, was the suspect interviewed? Yes or no. And as we started working through this process and becoming more aware, I guess, of laud police processes, is if you don't have enough to arrest somebody, you can't make them come in for an interview. You know, and even if you can bring them in for an interview, if they don't want to talk to you, they don't want to talk to you. You know, so we felt we needed to break that checklist down a little bit because just a simple yes or no was not sufficient. You know, we needed to know, well, did they make contact with the suspect? You know, if they did the person refuse to come in? Because I think that really provides more clarity around what was happening there.
Well, if I may just say one thing, Chief Bray, thank you for that question. And I think my question was actually in terms of, what happens to the police officer. I would like to, it's not about punishment, but rehabilitation or some sort of opportunity for growth. And I think Sergeant Jackie, did highlight on the fact that there is actually opportunities as well. And sometimes victims don't want their files to be reopened. My question was actually in relation to, if I was a police officer, I would like to know what I've done wrong or what I've done right. And I think, so that I can do better. And so when I say what happens to the police officer, I want to know what kind of services are actually available for the police officers that have conducted those interviews or have been involved in that process. So I thank you for that clarification. That's all I have really. And again, good luck. I think this is a very important project, and it's a very tedious task as well. So all the best and more grease to your elbow. Thank you.
Thank you. It's been a wonderful process. I have high hopes for things to come as the policy and everything is really becomes embedded. Mm-hmm.
Thank you, Commissioner Bucci. Councillor Bresciani.
Thank you, to you, Mayor Masters. Thank you for the information. When will this policy be shared with the Commission? Through the Chair.
I'm sorry. Go ahead.
Policy shared with the Commission. The policy's been approved by our executive, so it has been put in place. I believe it was in place prior to our block training starting this year. We wanted to make sure that it was in place. I believe it was actually before Christmas, so sometime in December when it was approved by our executive and put into place.
Thank you. Will that policy be shared, I guess, with the Board of Police Commissioners is what I'm asking, just to look at it?
I can bring it forward. I mean, we typically don't bring policies necessarily forward for discussion at board meetings, although I know we have from time to time in special circumstances. So I'm happy to put together a report that gives you a chance to look at the policy, the changes that we've made, and the enhancements going forward. Sure.
Thank you. That would be great. I just to follow up on a couple of questions, and I did have an opportunity to go through the Canadian framework for the collaborative police response on sexual violence, and it was a really good document. What in there is kind of the questioning from officers, more of the sensitivity around the sexual violence. And I guess, is that part of our policy as well when we look at that this is very traumatizing for people who do come forward, and the type of questioning from officers in this regard, more of not interrogative, but more of a softer type of questioning. Is that something that's in this policy that has changed to see that, to ensure that these difficult conversations are sometimes embarrassing for some of these individuals that come forward through the chair?
Thanks, Councillor Bresciani. Chief, do you want that one?
Sure, I can. Staff Sergeant Jackie probably could speak to this as well, but just generally speaking, I think you go back to training in police college. The training that we got in police college, when I say we, I'm talking Evan Bray, 1995, did I see Staff Sergeant Jackie's laughing at that, but it did differentiate, obviously, between, just the types of investigations that you do. And so understanding a sexual assault investigation is something, number one, it's a very in-depth, detailed investigation, but it's also very sensitive. And so the way and manner in which you approach it is different from maybe a routine break and enter. That being said, I think where we're at now and where we've developed over the last few years is really understanding a trauma-informed approach. And that's what you're speaking about, Councillor. And so that has been part of the training. Staff Sergeant Jackie, Lisa Miller, and others deliver that training to our frontline members. And that is actually becoming a staple now at the Saskatchewan Police College. So our frontline recruits will get that training, as will officers in our police service for sure, as a result of the pilot project that we've done and our commitment to this project going forward.
Great. I think that's really, really good. I think it's absolutely, again, it's kind of a different response, and I think that's great. I do want to ask, just in regards to the, there was in that report also talked about the more of the vulnerable, and we talk about, now I don't know, does this also, we've got the, domestic violence piece that is, that we were the highest domestic violence in Canada here. So how does this aid in that? And I guess, is there anything that comes out of this policy that can help us mitigate that, or anything that's a takeaway from this?
I'll jump in on this question, because I think domestic conflict and sexual assault investigations are very clearly and often closely linked. It's not that obviously all sexual assaults are as a result of a domestic relationship, but understanding trauma-informed investigation, understanding the need to not re-victimize someone who's been a victim of crime, understanding ways in which we can help them report it and give them confidence in the investigation that we're doing. Back in about 2018, we made substantial changes to how we handle domestic conflict, made enhancements to policy back then. And so I would say, rather than this informing our domestic investigations, it was almost the opposite. We improved our domestic investigation work and made some substantial changes about 3 years ago. This has happened in the last 18 months, and I think really stands up strong along with the robust domestic conflict policy that we have as well.
Okay, great. The last one through Chief or through Mayor Masters is regarding the youth. We've seen an increase in, through COVID due to the, I guess, sexual, I'm not sure the right word, but increases have gone up. Now, how is this a part of that as well with our youth as well, or is there an age in this area here?
Yeah, I don't know. I know, Lisa, you had touched on, I think the victim age is 16. So we investigate, or we review only files where the victim is over 16 and the accused or the offender is over 18. That's in line with the national kind of process that Sonny Mariner put together, and so that's part of the criteria. So we don't investigate, or sorry, we investigate, but we don't review those files. Oftentimes, I think when you've got a victim who's underage, who's a child, that is where our family services section will take over and do that investigation. So that's a very highly trained, specialized area of our police service where they receive specialized forensic interviewing skills and training on how to interview youth and the techniques, and that's all a trauma-led approach as well. So I think that's why there's a difference made between sexual assaults involving youth and those involving adults. I'm not sure if Lisa or Chris have anything to add to that.
No, that's correct, Chief. We've pretty much focused on 16 and above as far as the victims, and 18 and above for accused or suspects in this case.
Okay, great. And just the last question, I saw in the other report, one of the options can be utilized is a polygraph. Do we utilize that in any of the times when we need to, through the chair?
Staff Sergeant Jacques, do you have anything you want to add to that? I know polygraphs are used as part of investigative process. I don't know your experience with this pilot.
Not with the pilot. Polygraphs aren't something typically used in sexual assault investigations. Again, those are voluntary, and we struggle to even have the opportunity to interview the suspects in a lot of cases, let alone get them to volunteer to take a polygraph. So typically, you won't see very often polygraphs in sexual assault investigation cases, although they are a prerogative of the investigator if they feel there's value in it, and if the suspect is interested and willing to take one in order to establish some form of evidence. But keep in mind that those are not submissible as concrete evidence in court either.
Okay. I was also saying like the victim, the polygraph for the victim. No, nothing like that. Okay. I did see that in the core review criteria within the framework. It was on point number 4, victim polygraph tests and statements. So I was just wondering if we utilize that. We
actually strongly avoid that in our even to recommend something like that. That falls under victim blaming, and it's not something. It's questioning whether or not the victim is telling the truth. So it's not something that we typically would recommend that our officers bring up. One of the cleared statuses that we're concerned about is if the event didn't take place at all is one of the clearance statuses. So we won't try to make sure that we do all of our investigative means first. We would never want to suggest to the reporting victim that they weren't telling the truth unless there was substantial evidence to indicate that. In that instance, we likely would not move towards a polygraph. We would let the evidence sort of take us where it needs to go and conduct an interview with the victim in that case. So that would be the potential where, let's say, a suspect would subject themselves to a polygraph opportunity to try to prove their innocence.
Yeah, through the chair, that was my point. It would be in their favor, that they feel very strongly that they feel comfortable in taking, not that police would, it would be in their favor to help their case is what I was suggesting there. So
Thanks.
That's all I have. I want to just say thank you. There's lots of work here, and I do look forward to the report coming back to the board
Thanks,
when it's completed.
Thanks, Councillor Bresciani. Commissioner Yee.
Awesome. Thank you so much for this great report. I guess my question or comment come towards Chief Bray and even Katrina Swan, because she's done so much work in this. When I was reading this, I kind of just, I'm seeing some links here between the missing and murdered Indigenous women and girls calls to justice. With regards to, especially Section 9, with regards to educating, support, partnerships, training. A lot of what you guys are talking about kind of links up to Section 9 for the calls of justice. So I guess my comment or my question to Chief Bray is, do you see some alignment here? If so, if this is going to move forward, like can we better align these two, or is that kind of too many models kind of merged into one program?
Yeah, thank you, Commissioner, for the question. I think you're bang on. It 100% aligns with some of the objectives and the calls to action, calls to justice from the MMIWG inquiry. Part of our commitment, and I spoke about this a bit earlier when speaking to Councillor Bresciani, is to make sure that all of our processes are connected in a way that we provide ultimately the best customer service for people that are going through traumatic events. So understanding that, for example, intimate partner violence and sexual violence sometimes can be interlinked. We know that the rate of victimization, for example, in our community, in our province, amongst Indigenous peoples, especially Indigenous women, is misproportionate to the rest of the population. And so making sure that we've got really good investigative techniques, collaborations and partnerships that can minimize that can help people find healthy ways forward from these is important. I'm involved now, and we've got people at work that are involved in work with regard to coercive control. And so really that's about early indicators where we can step in, ask the right questions, involve the right partners to prevent someone from ultimately being murdered or seriously injured at the hand of a loved one. And so how do those things fit together? How can the police be an early warning system in the types of reports that are coming in, or the types of questions that we could ask, often with community partners, that would indicate this person is very vulnerable to potentially having serious harm come to them at a future time as a result of this pattern of behavior, which we know is an understood psychological process or almost a pathway to that sort of serious crime happening. So I think all of these things are very, very connected. And so having strong policies, strong training for our officers, and then incredibly strong links to community groups like the Regina Sexual Assault Center absolutely reduce victimization, hold offenders accountable, hopefully limit further victimization in our community, and speak directly to calls to action and calls to justice from the two inquiries.
Excellent. Thank you very much.
Thank you, Commissioner Yee. Seeing no other questions, I would like to thank Ms. Miller and Staff Sergeant Jackie for the presentation again. Outstanding work. It's really nice to see Regina taking the lead on this, and thanks to the RPS for supporting and undertaking this as well. Nice work. Commissioner Yee, do you want to move the report for a motion to receive and file?
I would be honored to move this report.
Thank you, sir. I'll call the question. Anyone opposed? Seeing none, carried. We'll now consider PO 21-19, use of force year-end 2020. Chief, can I ask that you please introduce the report?
Sure. Thank you very much, Mayor Masters. This is our annual report we bring forward in the public session of our board meeting to talk about use of force incidents. We track this, we assess, evaluate very carefully every time that our officers use force throughout the year. Our use of force chair is Inspector Tim Seiferling, and he's making a rare in-person appearance, so not virtual, in person. And I'll turn it over to Inspector Seiferling.
Thank you for the introduction, Chief. Good morning, Mayor Masters, members of the board. In 2020, the reported uses of forces by the Regina Police Service members increased by 53 incidents, or a 19.2% increase in comparison to 2019. We had 329 reported incidents versus 276 reported incidents in 2019. It's important to understand there's an approach of reviewing these incidents. I'm going to talk about our board that we have in place, our committee at Regina Police Service, how these reports are reviewed, and what we look at when we're reviewing these incidents. Regina Police Service has a use of force board comprised of 7 members of the police service and 1 person of the Regina Police Service Association who's an observer. We are mandated to review all reported incidents where members of the Regina Police Service use force. This board includes a number of different officers from around the service with different levels of expertise and either from our plainclothes section or teach at the Regina Police or the Saskatchewan Police College and have expertise in use of force or have high level understanding of different use of force options. The board members have a high level of expertise in all these force options. The board members meet monthly, and at the conclusion of each session, the committee will classify the use of force into one of the 4 categories that we look at. Number 1, the use of force is appropriate and compliant with policy. A level 2, the use of force is appropriate but less than fully compliant with policy, and we might need to look at coaching or some type of training that's provided. A level 3 would be inappropriate, maybe a remedial or discipline action is taken, or a level 4 would be something that's more serious where criminal charges were laid on that one. These packages will come to the committee through the chain of command. What will happen is force, there's some type of intervention on the street, a level of force is used, there's an injury or a complaint of injury. That package, that information is reported to the supervisor who's working on the street or in one of the different areas. That force package is reviewed by the supervisor. Comments are made at that level. There could be an intervention of coaching or training at that point identified. Watch commander will get the next level of oversight where they look at the package to make sure that all documentation is required, and they'll make whatever recommendations. The next level will go to a district inspector or an inspector in one of the areas of the service to ensure again that information is complete on there, and if there's any training or coaching identified or anything of any more serious nature. The use of force chair, which would be me the last couple of years, I would have that file next. I would look at it, I would do a summary of what we have, and then pass that information to the board members so that they can review it and be in time and be prepared for the monthly meetings. What we're looking for, we can go back to page 2 of that report. We're looking at the National Use of Framework and how that applies. So when we're conducting a review on the file, we're looking at a number of things. We're saying, is that officer acting appropriately based on the information that they're processing at the time? So if you look at that model on page 2, we're looking at that situation. We're looking at the environment that that officer is presented with, the number of subjects or the number of officers that are at the scene, perceived abilities of the subject, what's the knowledge of the subject, what's the time and distance, and potential attack signs. It's really important to understand that a situation that I may go into and how I perceive what's happening may be different. I have a sister-in-law who is probably, well, I'm 5'10", 235 pounds.
Thank you for disclosing.
240 pounds. 245 pounds, yeah. And I'm not going to tell my sister-in-law's weight, but she's probably about 100 pounds lighter than I am. So if we walk into the same situation, her perceived abilities and what she can do, her officer, my presence may diffuse a situation where she walks in and she may not be able to have the same presence, where she might have to have a different type of force. So we're looking at the totality of the event and making sure that it's reasonable what was happening at that time. Our officers go under, right from police college back in 1995 where the chief was, right up until current. We're looking at a bunch of use of force training when it comes to 80 hours of defensive control tactics, firearms, our taser training or CW, baton, rapid deployment, police officer safety training, which is post training and de-escalation techniques. After graduation, our municipal police forces take on that training also. So it's really important that there's a ton of training. So we're looking as a committee how that framework applies, how the criminal code applies to that. We make a recommendation on that and then can make adjustments with our experts that are on there, maybe through the police college itself for internal training on that one. Last year, as I said, we had a slight increase of use of force events. Really important to know is that one event that's reported will have a number of different options in there. So I'll use an example as the use of force may examine use of force package with one event and reviews specific use of force options within that event. For example, a pursuit may involve a tire deflation device followed by maybe a use of a taser and then maybe a takedown of the subject. Therefore, the one event will have 3 separate use of force options in there. So though numbers increased, it's important to understand that one event can have a multiple different components to it. Last year we used our restraint chair 21 times. Over 70% of those subjects were placed in the restraint chair were placed there due to a threat or an overt action of self-harm while they were in custody. The remaining 30 were placed in the restraint chair due to aggressive behavior causing damage. So we're just looking at different ways to make sure that they're safe. In 2019, there were 183 use of force events and 18 restraint chair incidents reported, which resulted in those 276 uses of forces. In 2020, there were 207 use of force events, 21 restraint chairs, which came to the 329 uses of force. If you look on page 4, the graph on there with the table, in 2020, one of our main areas of increase when we talked about the 53 extra incidents, we had almost 30 just alone in the vehicle mobilization techniques, which was the tire deflation device. So sometimes when you're looking at the data, you can see where one area on an increase on there, you can see where that can pop up a little bit. Currently, there's no manner in which we track this success of a de-escalation training. As use of forces are fluid in each incident, it would be difficult to determine if there were one or a combination of more. So officer presence, communication, or the presence of an intermediate weapon which resulted in compliance. So my presence alone could diffuse the situation. We can't really track that. So, and that's the end of my report.
Thank you, sir.
Thank you.
Any questions from a member of the commission? Councillor Stevens?
Thank you. I asked most of my questions in private session, but I have some follow-up. So just to be clear, the claim here is that the increased incidents of use of force appear to be circumstantial, and so there's something anomalous about 2020. Is that correct? Rather than a policy or a process that would involve the use of force.
I can even go back to, so 2018, we had a reduction from 2018 to 2019 in use of forces, and then back up in that. It's hard to pinpoint what exactly causes that. For us right now, I mean, if you look at the tire deflation devices is increasing, that use of force option is important because we're looking at community safety with this, where if there's somebody driving around dangerously with a stolen vehicle, we have the ability to slow that vehicle down and then take someone safely in custody. So, I mean, if you're just looking at the data, it's hard to pinpoint it directly. So,
okay, thank you. There's another data point on here through the chair, the K9 deployment. There are two line items, deployment with no injury and deployment with injury. The deployment with no injury declines substantially and goes to zero. What does that actually mean? Because there's another line item below it that says the number of injuries, which has actually gone up. So is it the K9 deployment is the same, but there's actually a higher rate of injury associated with that deployment?
yeah, it's the way we're looking at the deployment with injury, and actually we're working with the Sask Police Commission to clarify those two areas in there. What we're looking for is the deployment where the K9 goes and is physically bites that person on there. So we're using that as the force that option that's used on that. So that's how that's your question. So that'll be down to zero on that.
Okay, thank you. My final question, line item point firearm has also increased over the years. Again, is this just a question of the circumstance? I know in 2020 we did see a decline in the number of calls for the crime rate seems to have declined in 2020 for various reasons, but the number of point firearm incidents has increased. Again, is this just an anomaly and we might see it decline next year, or is there something else happening with that particular item?
We could look at nature of the crime on that, right? So it all depends on the call for service that these officers are attending. So when we're reviewing the information that they're processing, if there's a knife involved or a firearm involved, are they using the appropriate use of force or option when they're there? Probably hand in hand. Well, if the CEW is being used, the situation is obviously going to be if you look at your national use of framework, will be higher up into maybe you're worried about that person having bodily or using bodily harm or having the ability to cause death to somebody. So if those situations, then obviously we'll have either a use of force of a CEW and or even a firearm involved in that, where we're pointing. But again, with what we're reviewing, we're making sure that application of force is appropriate, it fits within the Criminal Code of Canada, and it fits within the national framework.
And if I can just jump in, Councillor Stevens, you're right. It is very much it's dependent on circumstance. So this is not a change that we've made in how we train or policy. This is about how those officers are responding to the situation. And you're right, although we did see a decline in crime rates, we saw our highest rate of firearms seized, highest rate of drug-related calls for service. Just this weekend, we had a call for service where an officer deployed a CEW because they were in the danger of being attacked by a person who had a needle on them. And so obviously that can bear a lot of risk to the officer, depending if it's used or not. And the CEW is used in that case. So it's very much dependent on the situation and how that officer assesses it and what they use to determine how they're going to resolve it safely. And then, of course, yes, then it's back to the use of force board to make a decision. Was that an appropriate use of force in that situation?
Wonderful. Thank you very much.
Councillor Stevens, would you like to make the motion to receive and file the report?
Yes, I'll make the motion.
Thank you, Councillor. I'll call the question. Any opposed? Seeing none, carried. Thank you, sir.
Thank you.
We'll now consider PO 21-20 variance report as at April 30th, 2021. Chief, could you please introduce the report?
Sure. So I'm going to just give a quick introduction and then I'm going to turn it over to Ms. Tracy Raisin, who's our Manager of Financial Services. This is new for our board as a result of a conversation that we had with the Board of Police Commissioners. Typically, we report on a monthly basis to the Board of Police Commissioners in the private session, and the Regina Police Service is included as a line item through the City of Regina's variance reporting. We are going to, on a twice-a-year basis, report variance publicly in our board meetings as well. So this is the first one of those reports, and I'll turn it over to Tracy to walk us through.
Thank you, Chief. Good morning, Mayor Masters and members of the board. As the Chief stated, I'm Tracy Reason, the Financial Services Manager. So I'm going to present the variance report as of April 30th. And since this is the first time in the public session, I'm just going to give a quick overview of the attachments. It's pretty straightforward, but I'll just point out a couple of things. So the first page is in regards to our operating budget. So the operating budget is a calendar year budget that has to be used by the end of the year. I split it into 6 categories of expenses, things like employer-related costs, facility costs, professional and external services, and internal expenditures. And then in regards to revenue, I split it into 4 categories. The majority of our revenue is costs recovered from the province or the federal government. And so those costs are all combined into those sections. The second page attachment is in regards to our capital budget. Now, capital projects, as you know, are done as a 5-year budget process, and they can carry from year to year. And this just gives you a status update as of April. As you know, those are usually our bigger projects, and they go on throughout the year. So as of April 30th, 33% of the year is now complete, and the Regina Police Service has consumed 29% of our budget. So we're currently projecting a small surplus of around $126,000. The surplus mainly comes from a number of retirements that we've had, so we have some salary lag in there. And so we're going to continuously monitor our expenditures throughout the year to ensure we remain on track and end the year again with that on budget or with that small surplus. Thank you.
Thank you, Mr. Raison. Any comments, Chief? You're good?
No, I'm good,
Okay.
thanks.
Any comments from the commission? Seeing none, I'll thank you very much, Ms. Raison. Can I get a motion to receive and file the variance report from April 30th, 2021?
I'll make a motion.
Thank you, sir. Any opposed? Carried. We'll now consider PO 21-21, the monthly crime statistics for April of 2021. Chief, it's all yours.
Okay, thank you very much. This is to give you our update crime stats, and this takes us to the end of April of 2021. So if I break it into the categories again, starting with crimes against property, we are continuing to see a decrease. We're down 22.6% over where we were at this time last year. And as I mentioned last month, this is to me where it's going to be very interesting to compare crime rates from last year to this year, because of course we know in the month of April last year was really our first full month into the pandemic. And so how have we adjusted, and what do things look like for our city going forward? We're seeing decreases in pretty much every category when it comes to crime against property. That's thefts, mischiefs, and even our theft of autos are down. They're not down a lot, 4.6%, but they are down, and so that's positive. Crimes against the person also is seeing a decrease, not quite as significant. We're down 8.2% over this time last year, and robberies are included in that. We're seeing a decrease in that category of 27.2%. Sometimes those can be very challenging as the weather gets warmer, and so we'll be monitoring and working proactively to try and keep that number low as we go through the summer. So overall, the Regina Police Service is looking at a combined decrease, crimes against property, crimes against the person, of 19.6% in terms of a decrease. And then again, at the back of our report this month, we have got the dashboards. We provide the drug overdose dashboard, which gives you the number of occurrences, how many police attend, how many times we've used Narcan. Along with that, the monthly and daily dashboard, which breaks down a little bit more of the social issues. So not necessarily, they're calls for service, but they're not necessarily crimes. So domestics, missing persons, suicides, and then a little bit with regard to drugs, firearms, and our COVID calls as well. So I'll leave it at that, and I'm happy to answer any questions that anybody might have.
Any members of the commission have questions? Seeing none, can I get a motion to receive and file the monthly report? Thank you, Commissioner Bushi. I'll call the question. Anyone opposed? Hearing none, will carried. Can I have someone make a motion to move into private session?
Bresciani.
Andrew?
Thank you, Councilor Bresciani. We are going to recess for 15 minutes. We will be back at 11:04. 11:04. Thanks, guys. Go refresh your coffees.